Joining me now is Christine Clark Lafleur, the Executive Director of Port Cares. And Christine, how have you been able to meet the needs of your clients at this time?
Well, I'm really proud to say that we were actually way ahead of the curve in terms of preparing for pandemic. So we put a number of contingencies in place to be able to safely and appropriately serve the vulnerable people who we take care of. We are an essential service, and we have a number of programs. So our two core sites, our two core locations are open, but with a modification in services. At 92 Charlotte Street, we continue to have walk-in traffic, again, under very safe circumstances, and people who are homeless or in need of various supports for crises that come up in their lives. So we're attending to many of our calls over the phone and dispatching services to clients in need, connecting them with what they need. But our reach out center, where we have our food bank and our meal program, we've gone to a modified service. So we are providing meals on a takeout basis. So the meals are hot, they're nutritious, and we're packed in a takeout containers to provide to our guests. Similarly with the food bank, we moved last week to provide pre-packed groceries. So we have the groceries all pre-packed in bags, again compliant with our distribution for the amounts that you give to families and to individuals. So again, that's at the door service. So people are getting food, they're getting services, albeit in a little bit of a different way.
Now, Christine, it sounds like you at Port Cares seem to have had a plan in place for something like this before the pandemic even happened.
No, absolutely. I've had the opportunity to work in many different environments, and in the healthcare environment, where I was on the front line of SARS, on the front line of H1N1, and as well, I worked on a federal emergency response plan coming out of SARS with the medical director of Orange and Sunnybrook's emergency department. So again, the practices that you need to take, they're fairly standard practices. It's just how you apply them to your environment. So we were actually in preparation mode on March the 11th. We actually were ahead of the hospitals in going to single entrances and sanitation. But these are just the opportunities that we've been able to have because of that experience. So again, it's a delicate dance between underreacting and overreacting when it comes to the measures you put in place. But I think as COVID-19 makes its way through Niagara, I think people are going to be comfortable with those extra measures. So I'm very confident in our team. I'm very confident in what we've done, and I'm very confident in the community that they will practice physical distancing. I'm saying physical distancing because there's a lot of blurry lines out there, and everybody has got to be on their A game to compress the opportunity for spread and to really just crush that curve.
Again, Christine, it sounds like you're really on the ball. Like you say, you got ahead of the curve here quite early. Has the nonprofit sector pooled their thoughts and resources together in this situation to be able to share ideas and thoughts on how they can better combat this virus and the situation that we're in?
Well, from my perspective, I mean, we're really dealing in real time, right? We are in real time, and again, that opportunity to have that collegiality, it was gone, a few weeks ago. I will gladly share with anybody who needs assistance, but I think the one thing that this world has not seen is just the intensity of the rapidness of the spread. You blink and it's on top of you. And I think that, it's the window right now that we're in is all action. And I know that, again, not-for-profits have really limited resources. We don't have the luxury of having risk management departments or infection control departments, and yet we work with the most vulnerable people. So I'm hoping that as a sector, we've all been on our A game, but I also know that it's a big hill to climb. So again, Port Cares and Port Colborne, we're fortunate that just by the luck of where the world has taken me, we were able to move quickly, and the entire focus was on the preparedness. We haven't stopped. We have not stopped in 3 weeks, and everybody is lining up to do what they need to do. We had masks, and we had face shields, and we had sanitation wipes in early March. So it's just there are going to be many lessons learned from this experience, and I'm glad to assist where we can assist. But right now, it is all focused on providing the service in a safe and effective manner.
Well, that's impressive, Christine, and I really hope anybody that's from a nonprofit that happens to see this program can reach out to you and hopefully take some of your advice and use it for their program. Before we let you go, Christine, real quick, is there anything that the community can do to help Port Cares?
Well, we really do need ongoing donation of non-perishable foods, and as another mitigation, we ordered one of those storage pods, so those walk-in kind of trailer things. So we have that in our parking lot at our food bank. We're asking for the compassion of the community just to drop off donations in that pod. We're holding the donations of the non-perishables in the pod for 48 hours because, again, we know the science, the literature out there is still being developed, and we've heard everything from Center for Disease Control through to other science-based sources that COVID-19 can live on hard surfaces for 24 or 48 hours. Again, the science isn't clear yet, so we're not going to take any chances. We're holding those non-perishable foods in that storage pod for 48 hours before we bring them in the building. That's another, thing that, again, I'm going to be on a call later today, and I will share that with other food banks. But we would greatly appreciate any drop-offs to the grocery store bins that are out in the community, or to our pod at 61 Nichols Street at the food bank at the Reach Out Center, because we know we're okay this week, but we know it's going to go on for a number of weeks, and we're going to need those supports to help, particularly children. A lot of kids who are supported through the food bank.
All right, thank you very much, Christine. Again, anybody in the community, if you're around Port Colborne and you have some food to donate, Community Cares could really use your assistance now.
Great, thanks so much. We appreciate it here at Port Cares.